Welcome to the 7th video in our series on finding your weight loss path. In this video, I'm going to give you my big picture thoughts on surgical weight loss. If you are someone who is considering a surgical path, I want you to know that I care very much about your situation. I have you in mind with everything I'm doing here on this channel. I have not had to personally consider weight loss surgery, but I have sat with so many people who have, and I have worked with them over the course of years, and I connect deeply with what you're going through. I hope the resources here can be helpful to you. I have many of the same big picture thoughts on surgery that I do about medications. I won't rehash my whole philosophy here. Watch the previous video if you haven't seen it. The big picture is that we're trying to balance two broad realities. The first being that most people do not need and would not benefit from surgical weight loss. It's a very intense, very costly path with significant risk. And as a minimalist, I feel that every attempt should be made to help someone lose weight without requiring that. That's the one hand. And then on the other, we recognize that surgical weight loss is a legitimate path for some people. I have met people who have very clearly been helped by this in a profound way. And of course, I only want people to be helped in any way that they can be helped. I have told people in certain circumstances that I think they should consider a surgical path, and I will continue to do so if I come to that conclusion. My view is only that it's the right option for a very small fraction of people. One of my intentions is to help as many people as possible achieve their goal without having to go down the surgical path. If you can achieve your goal using the other paths, you get all of the benefit with none of the risk, and that is the best case scenario by far. I want to invite anyone who is thinking about surgery to take some time and consider a fasting path. Surgery will force you to make some serious changes in your life. You can voluntarily decide to make similar changes if you have an open mind to it. If you can learn to fast, to slowly and gently train your body to run off the stored energy within you, you can lose large amounts of weight naturally. I've seen people lose over 200 pounds by fasting. People would swear they must have had surgery. So I just want people to be aware that such a thing is possible with the right mindset. Now, fasting, which is obviously my focus, is not incompatible with a surgical path. It's not either or. Many people who may ultimately choose surgery might need to lose some amount of weight in order to qualify for the surgery. It's very common. And if you're in that scenario and the methods I'm discussing here can help you achieve that and ultimately get the surgery, and then that is further helpful, that could be a marvelous process. And of course, I would be so happy for you. And also, after surgery, there's long-term work that needs to be done to maintain weight loss. I see people in my weight management clinic who had bariatric surgery previously, and they are gaining weight again. And I often talk to them about fasting, which can be a long-term tool that can help people maintain the benefits of surgery. So it can all work together. If you have had weight loss surgery, or you're considering it, you're more than welcome here. I value your perspective, and I welcome you to share your thoughts and experiences.